The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul Wick. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Kim Thorne Motors, and, of course, our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist, and joining us from the Cleveland Clinic Union Hospital is Dr. James Goff, who specializes in sports medicine. Thank you for joining us this morning, Doctor.
Thank you for having me, Paul and Brad.
The high school football season kicks off next week, and along with it comes many types of sports injuries. Especially concerning to athletes, parents, and coaches are head injuries and concussions. According to the Centers for Disease Control, an estimated 300,000 head injuries occur among high school students and athletes each year. Today we're going to talk about the impact of head injuries and other traumatic sports injuries with sports medicine specialist Dr. James Goff, who has served as a team doctor for several high schools and universities. We'd like to remind you today that our program is also available on our podcast, which can be downloaded from the App Store on your favorite mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions during today's program, we invite you to post them up on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Dr. Goff, I understand you have some local ties to Stark County. Can you begin by telling us a little bit about yourself and your background?
Yeah, again, thanks for having me. I grew up in western Stark County over Massillon, and grew up there. My family and I still live in western Stark County, and basically went to Massillon, grew up there, played sports in the town, and graduated, went to Capital University. Then from there, went to Ohio University's medical school. Had the opportunity then to come back and do my externship and internship at the old Stark County Doctors Hospital, which was a great experience with some great docs and good training. Hopefully we can get the hospital back over there to restart the training programs. And then from there, I actually stayed in town, actually here in Canton, went to Altman, did my family practice residency. And then from there, I went to Ohio State to do my sports medicine fellowship, which was a great year, great experience. And then had the opportunity to come back to Stark County to start sports medicine at one of the local hospitals.
Wow. At Ohio University, did you ever see the small cars, the little cars that did the parade every summer and went up the street? And they had to push them up the road.
The old up Court Street. Yeah. Yeah. Nice little town down there. It was a good experience down at the med school.
My daughter went to Ohio University.
Yeah.
So. Okay, so let's talk about head injuries. How common in sports injuries, youth sports, all that sort of thing? Very common.
And, in the past 15, 20 years, there's really been a close look at concussions, sports-related concussions. It's in the news almost every week, whether it pertains to NFL, soccer, hockey, Major League Baseball, and it trickles all the way down to our youth sports. The CDC says 300,000 incidents of sports traumatic brain injury, but I would venture to say it's a lot higher than that. So it's very, very common. It's almost like an epidemic that we see right now in medicine, and that's why there's been such a push because of the potential long-term issues that you can have with repeated brain trauma.
A lot of people don't consider cheerleading a sport, but there's a lot of head injuries.
Yes.
And I have a friend whose daughter been dropped, if you will, numerous times.
Yeah.
And
a lot of head and neck injuries with gymnastics and with cheerleading. Yeah. And cheerleading right now is, to me, it's gymnastics with a little bit more of a flair to it. Yeah. And so, you do see a lot of head injuries, a lot of neck injuries with cheerleading, and you have to be very, very careful. I think some of the rule changes that they've had with not, doing pyramids and builds and, of course, throwing the cheerleaders in the air drops, right. That has helped. But you do see it a lot in the college level because they are doing a little bit more action with that.
Okay, so we seem to be... Everybody keeps telling us that, okay, we're making better equipment, we're making better helmets, we're better neck, better mouth, whatever. Where are we on this?
Well, it's a debated topic. In the past several years, you have seen improved, or what they so-called improved helmets, lighter helmets, more padded helmets, different shapes. You see the different brands of helmets from Schutt to Rydell to Zenith. They're all touted as being concussion-proof. They've tried to rate these helmets on a 5-star rating of what helmet is the best to wear, which I think is a not a good situation. There is no such thing as a concussion-proof helmet, and there will never be a concussion-proof helmet. I always go back, and people laugh at me, go back to the 1940s and 50s when we had leather helmets.
Yeah.
Those were more of a concussion-proof helmet than what we have now.
Why?
Well, I always ask a kid that has had a concussion, how would you play the sport differently if you just had a leather helmet or just a soft padded helmet on your head with a scaled down face mask? Would you hit your head and play the sport like you're doing now with just that on your head? And I always ask the question, what is the first thing a kid does when they first put their helmet on? When they first get their helmet? I know what I did when I put my first football helmet on. I went over and smacked my head up against the wall. You know, it's like, I mean, it's just, that's what but
have you learned yet?
Yes, I have. I've had my share of concussions. But I think you're in the future of this sport, they're going to have to do something with that. And you do see the softer shells that are being placed over top of the harder parts of the helmet. Whether those are helping is yet to be seen. There's still a lot of studies that are out whether those soft shells help diminish the impact or blow to a brain. But helmets, a lot of discrepancies right now in the studies. Mouthpieces, there's been a sort of again discrepancy whether mouthpieces can halt concussions or prevent concussions, and that has not been found to be truthful. It does help to protect the chin, the jaw, teeth, so it is very important to wear your in any sport some type of mouthpiece, whether it's basketball, soccer, just to protect the jaw. But is it going to prevent a concussion? No.
Okay, so we probably have head injuries in all ages, correct? Down to the littlest person to the adult. Is the helmet structure that a young person wears pretty much the same as a helmet structure of the pro players and stuff like that?
To an extent. Unfortunately, a lot of our Pee-wee leagues get hand-me-downs from it trickles down from the high school to the middle school, then the Pee-wees. But there has been, with the concussion issues the last several years, there has been a big push to get safer helmets, youth helmets that fit properly to these kids. It's very important. They're lighter helmets now. Again, they're a little bit different design. But again, it's. I think there are better helmets, and the leagues are purchasing good helmets for the kids. They used to be very heavy, and so in a young kid, developmentally, they don't have the shoulder strength, the neck strength to support a heavier helmet, and that puts them at increased risk of head injuries. So for like Pee-wee football, it's very important to really keep a close eye on those kids because they just don't have the support of their bodies to support a blow when they're playing the football game. So they're at higher increased risk for concussions because of their musculature and their brain, their body physique, and the weight of the helmet.
You know, when I was in high school, we had varsity, junior varsity, we had baseball, softball, or whatever. We didn't have all this stuff, you know. Like here we have soccer, which has become huge, I guess. And what about the injuries in that sport?
I see just as many concussions in soccer than football, American football. Of course, they're playing without a helmet. They're heading the ball, which has been found that you take multiple headers from the ball to the brain. There's been some studies that have shown some long-term effects of chronic heading. The youth sports programs in the country USA Soccer has banned heading in younger kids. So when you get to about age 13, 14, they start to allow some heading. And then when you finally get to 15, 16, with the support, again, of the muscles of the neck, that they allow to do proper heading, they're teaching that better. So that's part of the preventative measures that they're doing in soccer. But you still, when you're out playing a game, you go up to head, another person's coming in, you get knocked down to the ground. So you do see some just as many concussions in soccer.
It doesn't seem like that should be, but because
it's a tough sport. It's a contact sport, and it's you do see a lot of head injuries.
Yeah, if you don't think soccer's a contact sport, just watch some World Cup footage. You'll be surprised.
Yeah, it can be vicious out there. And when I was at Ohio State, I took care of the women's soccer team down there. You talk about competition; those girls can they get after it. It's and then, like I said, even around here, it's becoming more and more competitive. I know down at Fairless, they have a really good young program with their girls soccer, and a lot of the girls are playing, and it's competitive. It's rough. They get after it.
What's the thing with the sport with the? Is it not cricket?
You think of lacrosse?
Lacrosse, yeah,
yes.
And that appears to be on the rise.
Yeah, a little different helmet structure. It seems like the men, the boys have the helmets. The girls don't have so much protection as I think what they should have. But lacrosse is becoming a big sport as well in the spring, and I think you're seeing that alternative at like some of the larger schools, especially in Columbus. When I was at Ohio State, lacrosse was big. It was a big spring sport. But again, you see a lot of concussions with that as well. It's a contact collision sport, not as physical as what American football is, but it's at high risk too for concussions.
So in your experience, college, high school, you've been in probably pretty much all ages, professional teams. Do you see a difference in presentation of symptoms and athletic injuries at various ages?
Yeah, again, going back to the youth sports, these young kids just don't have the muscles up in their neck, their shoulders. If you look at an 8, 9-year-old, their heads are almost fully matured. Their bodies are really small. If you ever went to a pee-wee football, they look like Martians out there because they have these big heads, big helmets, and these little bodies. Where you look at the collegiate level, professional level, those athletes are developed. They're in the weight room. They're matured. Their muscular system is strong around their neck and shoulders. They can take the force of a blow to the head much more than what an 8-year-old, 9-year-old could do. So there is a big difference. Presentation-wise, concussions all present the same. Different exam, but their symptoms usually, headache, dizziness, fogginess. They're in a daze. You can tell by looking at an athlete when they're concussed. They just have, I call it the concussion face, or just the dazed face. They're tired. They're irritable. They don't want to do anything. Sensitivity to bright light, loud noises. They don't want to be around anyone. They want to be in a dark room. And so those are the symptoms that you see. And when you have a kid that's concussed, you have to recognize that and pull them off and get them evaluated.
Wow. Okay, first breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshoprx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Sunflowers are in bloom at Studio Arts and Glass. Hand-blown bowls, metal garden art, or take a class and make a dyed burlap sunflower wreath. Stunning art glass pumpkins in every color and size. The Fall Festival of Art, September 14th and 15th, from 9 to 8 p.m. at Studio Arts and Glass. We'll showcase area artists with fun Halloween and fall decor. Food and refreshments at Studio Arts and Glass on Apple Grove and 77 in North Canton.
Medicine Center Pharmacy was named the 2018 Best of the Best Pharmacy. And we'd like to thank our customers and our staff for the honor. Our 13 pharmacists in Canton, Louisville, Minerva, and New Philadelphia help keep you healthy and save money. From free kids' vitamins to compounded prescriptions and affordable diabetes care. Ask how we can help. And don't forget, we have free screenings at our pharmacies on Tuesdays. Call 330-454-8772 for more information or visit medshoprx.com. medshoprx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about head injuries and concussions with Dr. James Goff from Cleveland Clinic Union Hospital. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed. So, Doctor, what are common and perhaps not so common symptoms of head injuries?
It's usually when we see a concussion occur. Of course, you see the blow on the field, whether it's an athletic trainer, coach, parent. We usually go over and assess them, but the most common symptoms is a headache. Mm-hmm. Again, they look dazed, visual problems. They're tired, they're fatigued. Those are some of the most common types of symptoms that we see during a concussion. The symptoms we don't like to see that are not common but throw up a very big red flag to us is when seizure, vomiting, loss of consciousness, numbness, tingling, weakness in an extremity, they're complaining of neck pain. Usually that's a trigger to us. Even when you look at their pupils on physical exam, if their pupils are dilated, they're not just looking right, sometimes they have to go to the hospital. And that's just a given. Neck pain, loss of consciousness, seizure disorder, nausea, vomiting, because you have to rule out other entities other than concussion, such as a subdural hematoma or a brain bleed. So you have to be very, very careful with that. Plus a neck injury, spine injury, fracture, which you always hear of once or twice a year occur.
What's the first thing we should do?
Take them out and get them evaluated. So it goes throughout all of sports, and it's the Ohio law now. This is the only sports-related injury that actually has a state law, and almost every state in this country has a law on concussions. So it immediately states that if a kid is being suspected of having a concussion, they have to be pulled out immediately. They have to be evaluated by a trained athletic trainer or physician, or they have to be evaluated in a stat care or emergency room if the symptoms warrant that. But they have to be pulled out, and they're not allowed to return without having a written note from a healthcare professional that's trained in concussions.
Are most high school football games, is there a doctor on the sideline?
Most, I would say around this area, most teams. Maybe some of the Akron, Cleveland schools. I know some of the Columbus schools. They may have other healthcare professionals. The biggest push is you need to have an athletic trainer on the sideline, not just for concussions, but for cardiac issues, for fractures. Athletic trainers are such a huge piece in sports medicine, and I work with some great athletic trainers around Stark County, Summit County, in Columbus, now down in Tuscarawas County. These people do so much, and they know the athlete so well. So sometimes, I may not know the athlete as well as what they know, and they can come up to me and say, hey, this kid is not looking right. He must have got hit wrong. He's experiencing some fogginess, dizziness. He just doesn't look right. I just know this kid so well. So that's the training and the reliability that I have for an athletic trainer. They need to be on the sideline because they can recognize a lot of this stuff. And not only athletic trainers, they take care of the coaches too. Some of the coaches end up with injuries and different things as well. But it's so important to have an athletic trainer. But that's, I think, the biggest push. The biggest thing is the money situation with schools. Sometimes they just don't have the amount of money to pay for an athletic trainer. But I think, to me, it's a situation where you have to have a trainer with medical legal issues. It's just like having a school nurse.
Sure.
So I can't help but think when you're talking about all this, I'm thinking about little voices in my head that say, be tough, play harder, you can shake it off. So what do we do about whether it's the player, a parent, an overambitious coach, or whatnot, the fans? How do we deal with that variable of peer pressure, for lack of a better word, to make sure that the right thing is done?
Well, that is probably the hardest part of my job, is to try to get people to understand how serious this injury is. I mean, you're talking about your brain. And I always ask kids and parents, do you pick up your computer and slam it up against the wall, or do you take your smartphone out of your pocket and throw it up against the wall? No. Same thing's happening to your brain when you get concussed. You are damaging your hard drive. And trying to get them to realize that this is a major injury that could have prolonging effects for your health. Your brain does everything and controls your body from head to toe. And so it's the education of trying to tell people that we have got to take care of these concussions properly. We have to rest. We have to go through neuropsych examinations. We have to be careful with this. And people just think, well, okay, I got a dinger, or, well, 30 years ago I played with a headache every day. I got hit. I still played. That's not the right thing to do, And so it is a challenge. And in this day and age, it is just getting worse and worse. And it's people just ignore it. You look at it, NFL, they're on it. They're under the microscope, so they have to really be careful with what they do on each team because they're under the microscope. Same thing like an Ohio State or a large college. You really have to be careful. But this is where you get the trickle-down effect with the Pee Wee football, the Midget League. Some of these parents are so amped up that their kid has to be on the field or he's not going to get a scholarship or he's going to lose a starting position. That is the wrong thing. The number one thing is you have a brain. You need to have that brain for 60, 70, 80 years.
Sure.
You're not going to be playing professional sports or even sports for a matter of just a few years. You have to get a job and maintain.
Okay. Time for the news. Listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The The summer driving season's here, and it's the perfect time to shop the largest auto mall in Northeast Ohio with one click at Kempthorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, and Sprinter, too. Something for everyone's price range. Kempthorne.com makes shopping easy, fun, and friendly. We also have a huge selection of pre-owned vehicles, and less than stellar credit is never a problem. The Kempthorne family name's one you know and trust. Committed to our community for over 80 years. Shop Kempthorne.com.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Sunflowers are in bloom at Studio Arts and Glass. Hand bloom bowls, metal garden art, or take a class and make a dyed burlap sunflower wreath. Stunning art glass pumpkins in every color and size. The Fall Festival of Art, September 14th and 15th, from 9 to 8 p.m. at Studio Arts and Glass. We'll showcase area artists with fun Halloween and fall decor, food and refreshments at Studio Arts and Glass on Apple Grove and 77 in North Canton.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of compression socks and hosiery. We carry Jopes, Trueform, Activa, and more. Low compression socks and hosiery are the everyday low price of $7.77. High compression socks and hosieries are $17.77. In-stock hosiery only. These prices are more than half off the regular price, and nobody can touch our prices. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we've been talking about head injuries and concussions with sports medicine physician Dr. James Goff from Cleveland Clinic Union Hospital. We've got a lot more to cover this morning, so let's get back to the show.
All right, what about, you had mentioned to us at the radio break here about a protocol to get a child back on the field that has potentially had a head injury. Mm-hmm. So how about we talk about that so parents understand what they should expect of their child's coach or trainer or organization?
So pretty much there's a protocol on how we take care of concussions, whether you're an Olympian or an 8th grader. If you've been diagnosed with a concussion, basically we have those kids rest, at least for several days, depending on how bad their symptoms are. We basically will put that child through a neuropsychological test called a sports concussion assessment tool that we use, and we follow that on a daily basis. We have them do a symptom score sheet, so we have them grade their headache, their dizziness, how tired they are they nauseated, are they having any vomiting. So we monitor their symptoms every day. A lot of times when we see those symptoms that are really bad, I usually have them come into the office to be assessed. Because with school starting, the worst thing you can do is send a kid to school with a concussion. Yeah. And so we have to actually have them out of school for a few days until their symptoms improve. And I always tell the kids are like, well, when can I go back to school? And the rule is I have them do homework for 10 minutes, take a 5-minute break, try to do homework, take a 5-minute break. If they can do homework for 45 minutes to an hour and not have any worsening concussion symptoms, then we try to get them back to school. But when they go back to school, we eliminate any test-taking quizzes. We decrease their homework assignments. Try to eliminate unnecessary homework if they can. During the school day, if they're having any worsening symptoms, they need to rest with the school nurse or with a school administrator for 15, 20 minutes. If their symptoms don't improve, then they have to go home and rest. But there's no driving, there's limited computer use. You really want to shut their brains down from all stimuli. So no loud noises. So they may have to go eat in a quiet room. They may have to avoid band and choir for a week. So there's a lot of things that we try to just keep their symptoms at a minimum. Once they improve and their symptoms are getting better, and usually it takes about a week to 10 days, then we have them reassessed. We will then even put them through a neuropsych computer test. There's a few of them that are out. In Stark County, we use the Impact. It's a computer-based neuropsych test for concussions, sports concussions, designed out of UPMC Pittsburgh. We down in Tuscarawas County use a CogSport. It's playing cards, it's memorization, it's looking at designs, trying to do memory recall. And so all the schools have to baseline their kids before the start of their sports season. So all football players, before they're allowed to start two-a-days, have to have a baseline Impact or CogSport or neuropsych test. So when they do get concussed, so now they're at that time where they're returning back to school. We're lifting some of their school restrictions. They're getting back in the lunchroom. They're back taking tests. They're back getting their homework back up. That's when we administer the neuropsych test on the computer, and then we basically can pull the baseline data and their post-concussive data. And we can look and decide, okay, is their brain back to baseline? Because when they take the baseline, they're normal, they haven't been concussed. So it gives us a check and balance. A lot of kids will fail the first time. And that is one of the most objective pieces that we have with concussion treatment right now, that we can see. Most of the symptoms with a concussion is subjective, meaning headache. You can't really see. It's not like a broken bone. You can't just flip up an X-ray or an MRI and see a concussion.
Okay, that was my next question.
Yeah.
Okay, you don't use radiology.
No.
Unless... What?
Well, unless you're looking you need a CT scan, MRI. If kids have had prolonged head injury or head symptoms, and it's progressing 2, 3, 4 weeks out, then you need to go look at an MRI to make sure that there's nothing else structurally wrong. But at the initial onset of concussion, unless you're having those red flag symptoms that we talked about, that's when you would get further imaging. But so once you get that neuropsych concussion test, and the kids past that, then we start a return to play protocol.
How much are you pressured by the parents? Oh, you got to do an X-ray. You got to you got to whatever.
That just goes back to education. You educate the parents. You give them handouts. Nah, I don't think we need this right now. If kids are having bad enough symptoms when they go to the ER will, if the ER doctor feels it's warranted, they'll do a CT scan there at the hospital. Not all the time. I have a lot of kids that they do present to the emergency room, concussion. They check out fine. They don't get a CT scan. Now, if they come into my office, again, showing red flags, nausea, vomiting, seizure, you need to get that checked out pretty quick. But in just the common, the regular flow of a concussion, the neuropsych test plays a huge role in that computer-based testing. For me as a physician, for the athletic trainer, because you can look at those scores and the various testing that the different programs that they put you through. It's a brain teaser. It's a pretty good test. So once that comes back normal to baseline or better, then we start a return to play guideline.
So why? Okay. I'll ask this question. Okay, so an individual student, whatever, has a concussion. I guess I don't quite understand why these mental test card thing or whatever you said you guys were doing. Why that's the direction to go, or why that's tells you that this person is still concussed or
yeah. So I get that question all the time. Oh, my son or daughter is not having any more symptoms. They're feeling fine. They're back to normal activities. Studies have shown that just because you're back to normal and you're acting normal doesn't mean that your cognitive functioning in your brain is back to normal. Studies have shown that it can take upwards of 7 to 10 to 14 days to get your cognitive functioning back after concussion. And so when a concussion occurs, it's not a structural situation that occurs in the brain. It's a physiological issue. It's like a bruise. You get a bruise on your skin or on your arm. That area of the brain is not functioning right. It's not getting proper blood flow. It has a lot of abnormal chemical imbalances in the brain that causes these abnormalities and these symptoms. So it takes a while for the brain to get back to normal. Even when your symptoms absolve and you're feeling fine, it still takes time for the brain to recover.
So we would think of that as like your brain being a milkshaker or something. It's just shook up, or
when a concussion occurs, I mean, your brain is sitting inside of a skull, so it's like an egg, and you're shaking the egg. The yolk is floating inside the brain, and that's what, or inside the skull, and so the brain hits up against the skull, causing a contusion. Sometimes you might get not so much a hit to the skull, but if you get like a whiplash type effect, your brain can actually rotate inside and cause rotational issues as well to the brainstem and to different parts of the brain. So it takes a while for the brain to recover. And the neuropsych tests that we do, that helps us out a lot. And it's now standard of care, so most schools should have that. And so that is a big piece of the puzzle. Once the kids pass through that and they're improving, and it's not just the neuropsych test that I use to get a kid back. I want to know how they're doing in school. So a lot of teachers will send me notes. Hey, little Johnny's doing great. He's back to normal. He's functioning well. He's doing well with his classroom work. He's getting back with A's and B's with his normal. And I ask kids, how are you doing in school? Are you getting your grades? And so it's a multiple faceted situation where you want to make sure everything's lining up right. The kid's not having any further problems in school, home life. He's able to watch TV. He's able to function. And again, the neuropsych test is back to normal. Then we start a return to play protocol, which usually, light workouts, sport specific workouts, non-contact full gear, full contact, then back to game.
All right. What about this? What about someone who had a head injury or an incident and they feel like they were okay and just either didn't talk to anybody or they let it go and they really have some problems that haven't been addressed yet?
Yes, and we see that happen often. And like I said, in this day and age, kids are ignoring.
So long-term issues, I mean, what?
Yeah, long-term issues. I mean, you can have chronic headaches. You can get post-concussive migraines. You can have cognitive disabilities where you're having a learning disability. You have to be addressed, with schools, and that's where the schools are such a help right now. And when these concussions about 10 years ago, the schools really weren't on board with concussions. And now with education with us, I go out to a lot of schools and I'll talk on like in-services for teachers when they have their in-services day about concussions and what we need to do in our schools. It's very similar to a kid that has ADHD or a learning disability. You have to give that kid a learning disability plan while he has a concussion. And if teachers are recognizing that they're not doing well, then we will refer kids to neuropsychologists for further neuropsych testing, not just the computer-based, but for written, and that's a 6-7 hour test. And that's where we need the neuropsych folks to help us out. So you probably, in my practice, probably once or twice a year, I'll have a kid that needs to get in to see a neuropsychologist, that they're having prolonged symptoms past 3-4 weeks. They're not doing well in school. They're not resting. But I have seen kids that, I got hit 6 weeks ago, and I just have not felt well. But again, this is where you have to have the adults, the teachers, the parents especially. I mean, everyone wants to jump on the teachers. It's the parents. You have to look at this and say, hey, we got to protect our kid. And so when we do see a kid, then you do put them through this protocol of rest and school modifications. And if it's bad enough, further imaging with an MRI, and then possibly even for a neurological testing with a specialist. Then sometimes we have to get them to a neurologist. But again, with neurology too, there's not a magic pill to take care of this entity. And I think that's where, if we could ever find a nice, and someday it'll come out, an image or a blood test, which they're working on. There's studies right now, they're looking for blood tests to rule out or rule in concussions. They're looking, but there's nothing solid or concrete right now that you can really use to say, yes, this kid has a concussion. We don't have an X-ray out there yet that says, or a lab work test that says, yes, this kid has diabetes or this kid has hyperthyroidism. We don't have that yet. And I think that's why it makes it difficult for parents and kids and coaches to say, well, the kid's acting fine. He's out there goofing around. Yeah, but he's concussed. And like I said, they may look fine, but it takes 7, 10, 14 days for the brain to get back to normal, if not longer.
Okay, final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Medicine Center Pharmacy was named the 2018 Best of the Best Pharmacy, and we'd like to thank our customers and our staff for the honor. Our 13 pharmacists in Canton, Louisville, Minerva, and New Philadelphia help keep you healthy and save money, from free kids' vitamins to compounded prescriptions and affordable diabetes care. Ask how we can help, and don't forget, we have free screenings at our pharmacies on Tuesdays. Call 330-454-8772 for more information or visit medshoprx.com. medshoprx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about head injuries and concussions with Dr. James Goff from Cleveland Clinic Union Hospital.
All right, I was just kind of wondering about, we're talking about concussions, but what about repeat concussions in the same person?
Repeat concussions, especially the last several years with a lot of NFL football players, a lot of NASCAR, a lot of hockey players ending their careers early because of the fear of multiple concussions. Once you get one concussion, it's easier to get the second one. Once you have the second one, it's easier to get the third, then the fourth, then the fifth. And sometimes it'll get to the point where all they have to do is just go out and run. I'm gonna go out for a jog. I'm gonna go swim. They get a headache.
Wow.
When you start developing those post-concussive symptoms that don't get improved, and they keep on, then it's time to call it quits. And there's a lot of evidence right now that's coming out that repeated brain trauma can potentially lead to further problems down the road with your brain, the chronic traumatic encephalopathy, which CTE. There's some evidence that says, yes, it's safe to play this sport, and yes, you shouldn't play this sport. There still has to be a lot more studies, though, and before that. Every week there's something that comes out in the journals for or against. What it comes down to is it's prevention. You have to be careful with hitting your brain. There are rule changes now. The Ohio High School Athletic Association, the NFL, they're all looking at football as one to say, okay, we're no longer going to allow run-ups on kickoff returns. So now I believe the NFL, you have to start at the line of scrimmage where the ball is and then take off. In high school and in middle school, there's no more kickoffs. You basically take the ball at the 35-yard line. Junior varsity, depending if both coaches say yes, we're going to have kickoffs, then you can have that. But you're going to see a lot of changes with sports, and just like we were talking about with the heading in soccer, you're not allowed to head in youth soccer now, so it's against the rules. There's a lot of rules that they've had in hockey with youth body checking and hitting up against the glass. You're not allowed to do that. Like I said, I think prevention with sports equipment is very important. There's newer equipment that's coming out that's being studied right now. Cleveland Clinic, I believe, now has they're testing a mouthpiece that has a sensor inside that if your head gets jarred or moved in a certain position that could relate to a concussion. Again, ongoing studies. It's every week there's something new coming out. But yeah, when you have repeated head concussions, traumatic injuries, and like I said, you were seeing it every week that an NFL football player is hanging it up early because of just the fear of brain injuries. And everyone now has asked me, if you had a son, would you let him play football? Yes, because football is a great sport. It's a team sport. You have to work as a team. It shows them discipline, hard work in any sport. Would I allow my kid to play peewee football? No. With what I know, I would probably say no.
What's the peewee age? I mean,
second grade now. Which is, you got a developing brain when a kid is 6, 7, 8, 9, 10, 11, 12, all the way up to 15. That is where the brain is developing the most. So my opinion is that if I had a son that was playing and wanted to play football, they would play flag football. They would learn how to play the game. They would learn how to control their body. They would learn how to throw, catch, block, do what they need to do to work with their hands on flag football and not their heads, and then allow that kid to start playing 7th, 8th grade ball. And I think that's where American football has to make some changes. I think, there's a lot of other confounding issues when you're having a kid play second grade in football. There's a big age discrepancy because they play against 3rd graders, 4th graders. There's a lot of size differences in those developing kids.
Well, we see that in a baseball scenario. Yeah. I mean, some of these kids are huge, and there's 8, 10, 11, 12 years old. Wait a minute, where'd you get this kid?
Exactly, yeah. So, that's where I think it's common sense rules that need to change it. Unfortunately, as we see with anything, there's a little bit of money driven, a little bit of politics that come into that. But when you look at American football, I think we need to preserve the sport. We have to make some changes, and we have to make some tough changes to preserve it. I'm all for flag football in youth ages so that these kids learn how to play the game and learn to work with one another, learn to control their bodies. And, even with prevention, learning when you're in middle school, learning how to play the sport, do tackling drills without shoulder pads and without the helmet. And if you look at the old-time players back in the 40s when they had no hard helmets, they tackled properly. They tackled with their shoulder. They tackled with their arms. They wrapped their body, and they ran through. They didn't lead with their head and try to explode somebody with their head. So I think a lot of common sense changes need to happen to preserve the sport, and other sports are taking the lead in doing that. Like I said, soccer, hockey, they've taken those leads.
So in the sporting world and in the schools, what's now the most popular sport? Is it soccer, or is it still football, or where are we at here?
Well, I think in Stark County, football is huge. But what we were talking about before the show, these smaller schools, their numbers are down. Yeah. And people are like, oh, it's because of concussions. I don't buy into that. No. I think some of it is there's other sports There's a lot of other activities that these kids are in that are taking up their time. Back in the day, you played football. 30, 40 years ago, there wasn't soccer at a lot of these schools. There wasn't, some of the kids, they low golf teams now. So there wasn't a lot of fall sports other than that football. So, but I also think kids are, they're being tugged and pulled, and some of them just, football is a rigorous sport.
Okay, Doctor, we'd like to keep you around for a couple more hours here. We're learning a lot of stuff, but unfortunately...
it's a rainy day. There's no golf today, so
the producers said we got to get off the air, so here we go. Okay. Thanks very much, Dr. James Goff, sports medicine physician from Cleveland Clinic Union Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please make sure you contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass, Kempthorne Motors, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. And we are a local Health Mart pharmacy caring for you and about you. Have a healthy week. We'll see you again next Friday right here on News Talk 1480 WHBC. And we will be at the MAPS Museum next Friday in the tent of a former U.S. Army medic.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.